I want to welcome Dr. Jose Almeida for giving this introduction about the upcoming meeting at the International Vein Congress in Miami, Florida, from April 18th to the 20th, 2024. So, Dr. Almeida is one of the worldwide leaders in the diagnosis and treatment of venous disease. I want to congratulate you on your 22nd year of this. How do you keep this going year after year?
Yes, been a little bit of a ride, certainly a lot of work, and the first few years were super challenging just to get something going, and of course the last few years with this whole COVID business has been challenging getting back on our feet like all vascular meetings. So yeah, but it's been a very good ride and made a lot of good friends, and we've been very fortunate and lucky to still be here. Yep.
So what's your vision for this meeting? How did you get it started? Why did you get it started? And how do you keep it going?
Yeah, so that's an interesting question. You know, it's really the first non-societal dedicated Venus meeting. So we had the American Venus Forum, um, which was really, at that time it was an old boys club capped at 300 members, and really it was more about physiology, calf pump, and I had gone to a couple of those, and then there was the ACP that was the exact opposite, more on like sclerotherapy. It was multi specialty, not very scientific. And I went to both of those as I got interested in venous disease, in the late '90s, and I was, nobody's talking about these ablations, these new things. And as we were early adopters, and uh, really, it was one day a patient, I'm getting her booked for a laser ablation. She goes, "Why are you the only one doing this?" And I was like, I'm thinking I'm like a cutting edge guy, pioneer. And it occurred to me, wow, man, this is a liability here. I mean, this isn't out there yet. This is not standard of care. I'm doing this stuff in my office, and this is the wild, wild west. So let me get some like-minded, there were maybe not even 12 of us back then, doing this. Let's get some like-minded individuals and get this out there to show what we're doing and educate our peers, and it's the standard of care. And actually the first few years when I presented at our local Florida Vascular Surgery, they were throwing darts at me. What are you, crazy, doing this stuff in your office? So anyways, it was clearly the future. And for me, I did my very first RF ablation when it got approved in '99, and I was like, this is it. This is clearly the future. I didn't need any randomized controlled trial. This is it. And I started weaning off of arterial disease, and had a all venous practice by '03. After 5 years of practice at a vascular surgery fellowship, that was it. I'm done with arteries. I need to get on the venous thing here. So that's how it started. And we did live cases up until the pandemic. So we'd show people with live surgery how to do these thermal ablations, how to do domestic anesthesia, how to do a phlebectomy, how to work the patients up. And then we got into stenting, showing those live. And it's always been a practical meeting. Speakers that most of us are all 100% venous practices, speakers that run practices and give tips. So physicians come and they go home with 5 to 10 pearls that they can, take away immediately. And that's why I think we've been successful. And we try and really keep up with everything, all the nuances and the new things coming out, and try not to get, lose the importance of hemodynamics and patient evaluation. And lately a lot on all this inappropriate use business that's going on. So really a lot of on appropriateness. But the latest is the what we're talking about now is the slamming that we've taken in reimbursement. So as most of us know, 70% or so physicians are either employed by a hospital or private equity group. So those of us in private practice are really just hanging on. And the venous reimbursement in particular, we've taken a 50 or 42% hit over 10 years, 50% cut in phlebectomy, which is for me the index procedure. That's really the one that brings patient satisfaction. So we are a struggling practice also. So, and not to my credit, but my wife recognized early, she's my administrator, you better bring on some other services. And I'd been this kind of a vascular surgery brand. I don't want to step, scope of practice, go into cosmetic things, for example. So how can you bring added revenue to your practice? Well, there are things in the aesthetics and wellness space that are out there. Patients, it's a growing market. I mean, it's a huge growing market. Uh, and at least in Miami, I mean, so our medical type spa, it's probably half the income now from the vein practice, and that's all cash. So what we're trying to do this year, we've set up some workshops and sessions so this is the theme. We're getting killed to reimbursement. You want to stay alive in private practice. Here are some things you can do. And so we've got specific workshops in aesthetics, in wellness. We have 8 hours of dedicated ultrasound for ultrasound technicians. So that's the other thing. We have a bring your entire office package. Bring your office manager, bring your, and I hate this term, mid-levels. I guess APP is a new term, advanced practice practitioner. So, but nurse practitioners, PAs, nurses, bring them, bring your office managers, bring your vascular techs, and we have dedicated workshops for all of them. So the office managers, we've got Candy Hammond and a couple speakers setting up a few sessions on, running an office, insurance-based office, and the challenges there, especially pre-authorization and collections now. And then the other side would be, okay, these are things you can add cash to your practice. You can also use your advanced practitioners, your mid-levels, to leverage, to scale yourself. So you don't have to do these things your own. But, things like Botox, there's some devices now that we use here for body contouring, for face, that I was a little, reluctant at the beginning. I'm not a plastics guy or a derm, but it's really not that complicated. And the device companies help you implement this, and we have a nice staff, and it's doing quite well. So we want to bring this to our community of now, 22 years. We've got a good following, and I think we've got a lot of trust built. I've always been I've positioned myself as the course director very neutral. So when you look at my disclosure slides at a meeting, it says no financial. I don't do any consulting for companies. You go on my open payments, you go on the website that's public, you look at me, I'm at the bottom at zero money from industry. So I like to do that because I want to invite our industry partners. They got, it's an equal playing field. You guys come to the meeting, we're going to talk about all the products in the generic fashion. But when we go to breaks and our attendees go to the exhibit hall, you go there and flush out the nuances with the exhibitors and see, what products would best serve you. But it's not me promoting anything. I'm staying neutral, and I think that's been very appreciated through the years. And the meeting has built trust in that fashion, that we're not really out pawning, devices for people. So I've said a lot, maybe a lot to unpack there, but that's kind of the historical perspective of IBC, from my viewpoint, and how we've gotten to where we're at. And we've always embraced the challenges along the way, be it just, getting your practice out there at the beginning, learning the new devices at the very beginning, to, these board certifications that were out there, whether you should participate in that. If you're a fellowship trained vascular surgeon, this phlebology board that's out there didn't make sense to me. So, we discussed that. That was quite controversial and upset a lot of people, but I think it needed to be discussed in a public forum. And now it's really the problems we're having with reimbursement. I mean, we got to put it out there and deal with it. So that's it.
I like the fact that you have some really practical tips and also some very practical tips for the office. So can you highlight on some of the new things that are coming up at the meeting? You hit on some of them. Are there some new topics or new things that you're going to be bringing out, some new technologies? You mentioned some of the ideas and the concepts, and
Yeah.
they're very current.
The so a- as so the venous space is superficial and deep. Deep is you can break up into chronic deep like stenting and acute deep as in deep vein thrombosis and thromboembolism. So I put them really into three buckets: superficial, deep vein stenting, and thromboembolic. And that's kind of the way we set up, our general session. Thursday is mostly superficial talks. Friday, mostly deep vein stenting, deep vein hemodynamics, workup of deep vein patients. And Thursday and Saturday, I'm sorry, the thromboembolic, all the mechanical thrombectomy devices, we get into DVT. Now, as far as ablation, we go into the old RF and laser that's out there, but the newer things would be non-thermal. It's not that new anymore. There's some newer devices that Lowell Cabinet will be discussing that are coming down the pike. With stenting, we have our dedicated Vita stents now. The data is rolling out, so we get into that. There's a new stent from Philips coming out called Duo, which may or may not be ready at that time. And really in the thromboembolic space, there's a lot of new companies coming on board with mechanical thrombectomy. So, they'll all be there. We have afternoon workshops on, for example, Thursday, superficial day. There's an hour and a half, hands-on stations, setting up a superficial vein practice. On Friday, setting up a deep vein practice. How, in that case, how you balance the office with the hospital. And on Saturday, setting up a thromboembolic practice, which is mostly hospital. So we've got experts talking about those hands-on stations with the device companies. That's new for us, something that we haven't done in the past. Um, so it's a Venus meeting. I mean, it is a Venus meeting, hardcore to the bones, but it's more on practical tips on how to evaluate patients and take good care of them. And then the real new things would be Sculpt Neo. I don't know if you've heard of it. BTL is a device that it's a muscle contraction device. So you may know I've been a gym owner for 7 years. I've been trying to get people to exercise, and a lot of people just don't want to. So this is a gym in a box, so to speak. You have this device. You can set it on, for example, your abdominals, and it simulates 10,000 crunches in a half hour. I mean, I've done it. It pulls on you. It really, it's amazing. Burns fat and stimulates muscle. So you can pair that up, for example, with weight loss now and all these GLP-1 agonists. So we'll talk about that too, how you can get a little weight loss going, a wellness program in your office. If you lose weight too fast, you're going to lose muscle. So you may want to pair up a muscle building device with your GLP-1 agonist. We also have a DEXA scanner to measure body composition along the way. So this is part of our wellness program that we do in the office that we're going to educate, our the folks that come to the meeting that have an interest in this. There are so we aesthetics we separated into face and body, and there's micro needling. You're looking at me. You've never heard of this stuff. You're a vascular surgeon. There's no reason you should, but maybe it's out there. There's a device called Morpheus, a company called InMode. They'll be there. Women are loving this, and men. It's collagen stimulation and tightens the face and the body. It's a big hit. It's one of our busiest machines at the office, and I don't have to be in the room. And then there's all kinds of hydrofacials and other things that folks are asking for. We even do some tattoo removal. That's an interesting story behind that. But a lot of added services that you asked me 10 years ago, I would have never envisioned this in my practice. As a guy that came from hardcore aortic surgery to then being a surgery to now offering this, it's just I'm rolling with the times. I don't want to get, I don't want to sell out to private equity or hospital. I mean, I enjoy my private office. So, and I think most people or a lot of people feel that way. So, again, these are just ideas for people. things that if one is struggling with venous reimbursement, as I suspect many people are, unless you're doing unnecessary. I mean, that's the other thing. You can just do, a bunch of unnecessary ablations on people and make money that way. There's people doing that. That's, of course, not, I'm being sarcastic. But if you want to still take good care of patients on the wellness side, and we're also going with a national trend of moving from sick care to well care. I mean, there's a lot of pushback on our healthcare system, which is broken by folks. A lot of lost trust out there, big pharma, and we're part of it too. There's a lot of trust being lost by doctors. All we do is push pills. Well, I mean, our poor primary care colleagues, they're stuck now where you got all this EMR documentation you have to do. You have to see 60 patients because they're paying you poorly to keep your doors open. Well, you can't have an hour conversation on how to stop smoking and eat right. You got to get their blood pressure treated, or you're liable if they have a stroke when they walk out your office. So, yeah, you got to push pills. This is a really screwed up system. So it's really been about sick care and not well care. And this is something that you can implement. I mean, we're vascular surgeons. We take care of atherosclerosis. There's also medical things that we'll talk about that one can do to take care of arterial patients if you don't want to operate them. I got a full stable full of claudicants and carotid lesions that we follow and small aneurysms. And when they need something, I send them to my arterial buddies at the university. So the point I'm trying to make is we're struggling with traditional venous surgery and current reimbursement, and you need to maybe start opening up your mind and thinking out of the box a little bit if you want to, stay solvent in this current environment.
I like the fact that you really try to make certain you take the high road. That sounds like a consistent theme that you've been talking about for many years, quite frankly. On that vein, you get some really amazing speakers at your Congress. How do you maintain the excellent quality of your amazing speakers?
Yeah, we've got a core group that always comes, and frankly, they're just my friends now, and I'm like privileged and honored every year that they say yes, that they'll come. And then we always try to mix in a few new people just to kind of keep things, um, so I guess we're doing something right because we are our faculty is the who's who of venous disease, and they come back every year when I ask them. Thankfully, of course, it is Miami Beach. It's a beautiful, I mean, it's a beautiful place. We let people out at 5 o'clock so they can enjoy the nightlife. And there's, plenty of restaurants and bistros within walking distance of the hotel. The hotel is right on South Beach. So it's not a bad place to be. Um, so we do emphasize that we want people to get out and have a nice time, bring your family. There's a pool, there's a beach, there's kids' activities. We emphasize all that. So it's in April. The weather's usually very good, and you can have a nice time there. So all of that put together, I think has been made for a nice meeting. This year we won't be doing live cases. I hope to get back to them next year. This COVID thing really, set us back like a lot of meetings. It was, the old the industry participation and this whole virtual thing, I think really hurt a lot of meetings, but I think we're now back, everybody's in person, industry's back, getting out on the road again. They were all stuck working from home. So we saw it at VEITH in November. I mean, the buzz was back and people were out there shaking hands again. This other ISET meeting here in Miami that I participate in every year in January. It was very well attended, which I was very happy. So I think we finally seen the transition from this whole COVID thing from virtual to in person. That's finally recovering or recovered 4 years later. I mean, I can't believe it took 4 years, but I think that's where we're at.
I want to thank you. This sounds like a really great meeting that's coming up, and I hope to see everybody in Miami on April and at the IDC meeting.
And we'll have to have you down, Anil, one year as one of our star speakers. So maybe next year we'll get you down here.
Thanks a lot. Looking forward to the meeting.
Well, thanks, and thanks for interviewing and letting me get the word out. Appreciate it. Okay,
Thank you.
thanks. Bye.